Hi guys, you are watching my YouTube channel, Hidden Facts. Do you wanted to know some extra about coronavirus? This video is extremely helpful for you. I suggested you to watch this video to its full length. If you find this video knowledgeable for you, then please like the video and subscribe the channel for upcoming outstanding videos. Now move to our video. Coronaviruses are common in different animals. Rarely, an animal coronavirus can infect humans. There are many different kinds of coronaviruses. Some of them can cause colds or other mild respiratory, nose, throat, lung illnesses. Other coronaviruses can cause more serious diseases, including severe acute respiratory syndrome, SAARS, and Middle East respiratory syndrome, MERS. Coronaviruses are named for their appearance. Under the microscope, the viruses look like they are covered with pointed structures that surround them like a corona or crown. COVID-19 is a disease caused by a new strain of coronavirus. CO stands for corona, V for virus, and D for disease. Formerly, this disease was referred to as 2019 novel coronavirus or 2019 nCoV. The COVID-19 virus is a new virus linked to the same family of viruses as severe acute respiratory syndrome, SARS, and some types of common cold. Is this coronavirus different from SARS? SARS stands for severe acute respiratory syndrome. SARS-CoV is thought to be an animal virus from an as yet uncertain animal reservoir, perhaps bats, that spread to other animals. First infected humans in the Guangdong province of southern China in 2002. In 2003, an outbreak of SARS started in China and spread to other countries before ending in 2004. The virus that causes COVID-19 is similar to the one that caused the 2003 SARS outbreak. Both are types of coronaviruses. Much is still unknown, but COVID-19 seems to spread faster than the 2003 SARS and also may cause less severe illness. What is the incubation period for COVID-19? In a study of 181 patients with the novel coronavirus COVID-19, the median incubation period was found to be 5.1 days, according to researchers. Furthermore, they established that 101 out of every 10,000 cases will develop symptoms after 14 days of active monitoring or quarantine. These findings could affect current practices during the COVID-19 pandemic, which are largely based on the assumption of a 14-day incubation period. Earlier research based on 88 cases in China found that incubation periods can range from 2.1 days to 11.1 days, whereas a different study of 158 cases found a median period of 5 days. These findings are largely in line with the incubation periods of other human coronaviruses, according to the researchers. Gaining a more specific understanding of the COVID-19 incubation period could have notable benefits for public health recommendations, including active monitoring, surveillance, control, and modeling practices. What are symptoms of COVID-19? COVID-19 symptoms include cough, fever, shortness of breath. These symptoms are similar to the flu, influenza, or the common cold. In more severe cases, infection can cause pneumonia or breathing difficulties. More rarely, the disease can lead to severe respiratory problems, kidney failure, or death. If you have a fever or any kind of respiratory difficulty such as coughing or shortness of breath, call your doctor or a health care provider and explain your symptoms over the phone before going to the doctor's clinic. What should you do if you feel sick? If you have a cough, a fever, or difficulty breathing, and you are worried that you may have COVID-19, the disease caused by the new coronavirus, here are some recommendations. 1. Stay home and call a health care provider unless it is an emergency. To reduce your risk of catching or spreading illness, stay home if you feel sick, even if your symptoms are mild. Do not go to work, school, or public places, and avoid public transportation. If your symptoms are severe or you feel like you need medical care, call before you go to a doctor's office, urgent care center, or emergency room. Describe your symptoms over the phone. 2. Answer questions to determine your risk. When you call a health care facility, you will be asked about your risks for COVID-19. Risk factors include recent travel to certain countries or exposure to an infected person. For instance, people calling Johns Hopkins Health System hospitals or clinics are asked, have you had close contact with someone diagnosed with COVID-19, the disease caused by the new coronavirus? Close contact means having been within 6 feet of that person for an extended time, or being exposed to their cough or sneeze. Do you have a fever, a cough or difficulty breathing? Has a public health officer said you were potentially exposed to COVID-19? 3. Follow your health care provider's instructions based on your answers to these questions. The care provider will provide instructions over the phone. You will be told if you need to be evaluated, and if so, what to do next. Based on your risk for COVID-19, your health care provider may recommend that you continue to monitor your health and call back if you develop a fever or respiratory symptoms. Stay home and await further instructions. Report to a designated medical care facility for evaluation and treatment. It's best to go alone to your appointment. Do not bring children or other family members unless you need assistance. Go to a clinic or emergency department if you have more severe symptoms, such as higher fever and severe shortness of breath. 4. Practice hand hygiene and respiratory etiquette. If you do leave your home to go to a care facility, wear a mask so your coughs and sneezes are less likely to infect others. Masks are not recommended for healthy people in the general population. Wash your hands thoroughly, for at least 20 seconds, after sneezing, blowing your nose, coughing or using the bathroom, and before preparing or eating food. If you cough or sneeze, do so into the bend of your elbow, not your hand. Or use a tissue, and then throw it away immediately afterward. At home, clean often touched surfaces such as doors and doorknobs, cabinet handles, bathroom hardware, tabletops, phones, tablets and keyboards regularly with disinfectant. 5. Stay calm. The possibility of having a contagious illness is scary, but doctors, nurses and other caregivers are learning more about COVID-19 every day. They are working together with national and international agencies to identify and provide care to patients while avoiding spread of the illness in the community. How is COVID-19 diagnosed? As more and more people are concerned about catching or spreading COVID-19, the disease caused by the new coronavirus, many want to be tested. But different testing criteria, limited supplies and other factors mean that not everyone can get a test, particularly people with no symptoms and minimal risk factors. Coronavirus tests must be ordered by a doctor. If you feel like you may have COVID-19, it's important to call your doctor or care facility and follow guidelines on what to do. If you have a cough, a fever or difficulty breathing, the doctor most likely will first test you for the flu or other potential causes of these symptoms. In deciding whether or not it's appropriate for you to be tested for the new coronavirus, the doctor will consider risk factors, such as your age, your general health, where you live and work, your travel history and your symptoms. You are most likely to get a COVID-19 test if you have symptoms and you are experiencing severe symptoms such as very high fever or breathing difficulties that require care in a hospital. Living with certain health conditions, such as diabetes, heart disease, chronic lung disease, chronic kidney disease, immune suppressive therapy, working in a health care environment and providing direct care to patients. How is the coronavirus test performed? The doctor will put on protective clothes, mask, and face shield, and then collect samples. This involves swabbing the inside of the person's nose. The doctor then packages the samples according to guidelines from the Centers for Disease Control and Prevention, and then the samples are shipped to a laboratory. Some hospitals, such as Johns Hopkins, have testing labs on site. The laboratory tests the specimens for the presence of the new coronavirus, which causes COVID-19. The doctor reports the test results to the patient and to the public health authorities if it is positive. What happens if you're test positive for coronavirus? If your test shows that you've been infected, your doctor will advise on next steps. Most cases of the illness are mild and can be managed at home. Why can't everyone get a coronavirus test? Some areas in the world are experiencing a delay in getting tests for the new coronavirus. In other areas, guidelines for whom to test are very narrow. The test is currently time-consuming to give, and, at present, takes several days to get results. As of March 19, 2020, the federal government is examining the most appropriate ways to administer the tests according to individuals' risk factors. If you've been tested once, do you need to get tested again? Possibly. If you are tested for COVID-19 and the results are negative, it doesn't mean you are protected from the new coronavirus. You can still become infected later and need another test. If you get sick and your coronavirus test is positive, once you are better, your doctor may order another test to gauge your recovery and make sure you are no longer contagious to others. What should you do if you think you've come in contact with someone who has COVID-19? If you think you have been exposed to COVID-19 and you develop a fever and symptoms, such as cough or difficulty breathing, call your healthcare provider for medical advice. If you don't have symptoms, you will most likely not be tested, but instead advised to stay at home and wait to see if you develop symptoms. How is COVID-19 treated? As of now, there is not a specific treatment for the virus. People who become sick from COVID-19 should be treated with supportive measures, those that relieve symptoms. For severe cases, there may be additional options for treatment, including research drugs and therapeutics. Does COVID-19 cause death? As of March 29, 2020, 31,734 deaths have been attributed to COVID-19. However, 145,625 people have recovered from the illness. Thank you for watching the video. There are two parts of this video, one you have watched and other will be uploaded soon. Take care and goodbye.